Hello to everyone in the Vanderbilt community. I am so pleased to be joined today by Dr. Jeffrey Balser, the President and CEO of Vanderbilt University Medical Center and our Dean of the Vanderbilt Medical School. Now, we all know that VUMC has been on the front lines of the COVID-19 outbreak from the earliest days, both in the hunt for a treatment and vaccine, as well as providing world-class patient care. Dr. Balser, thank you for being here.
Pleasure to be here with you today, Susan.
Why don't you start out by talking about how Vanderbilt University Medical Center has been involved as a global leader since COVID-19 was discovered at the end of last year?
We have a laboratory program here that's led by Dr. Mark Dennison. Mark's really led us in playing a central role in the development of drugs. There's other really amazing work going on in our vaccine center that Dr. Jim Crow is leading. He develops these things called monoclonal antibodies, where he takes serum blood from people that have had coronavirus and survived and analyzes their antibodies and finds the ones that really do attack the virus. And we just announced a few days ago a license with AstraZeneca to develop two of those antibodies that actually attack the virus in different ways and have a synergistic effect. And we think those antibodies can become both a treatment and a prevention for coronavirus, and we're very excited about.
Would you talk about some of the work that VUMC is doing around testing, patient care, data collection, infection modeling?
At the very early stages in March, when there was a CDC test that wasn't working so well and it wasn't very well distributed, Dr. Dennison was able to work with our pathology laboratory to develop our own laboratory developed test. So by the middle of the month, we were testing 700 or 800 people a day in the Nashville region. In fact, we were probably 75% of the testing going on in the entire state of Tennessee. And it was the data set that really allowed the city to make an early decision to shut down Nashville. And what that meant was that we were able to do this thing that was called in the media flattening the curve, such that in our worst situation, we didn't have more than 30 to 35 patients at Vanderbilt Hospital at any given time, which is pretty extraordinary considering what has gone on across the country. And it's a really good story about how science and clinical care can work together very rapidly to do something extraordinary that impacts public health.
Well, I know you and your team have really worked to help us develop this set of key prevention measures, those wearing face masks and cloths, physical distancing, symptom monitoring. We have this really robust collaboration across the School of Nursing, the Student Health, and Occupational Health, and we're really continuing, I think, to put in place what the best practices are that you're guiding us with.
There are very few places where you could send your child. We're one of the leading academic medical centers in the fight against coronavirus, sits on the campus of the university, and in fact, leads the student health service that is managing and taking care of the students. There are a few places like that, but not very many. So we're all in on this. And we see the students as our students. I think you can see behind me that Vanderbilt diploma. I'm one of those former students, and we feel pretty strongly about how the students are taken care of when they're here because we see them as ours.
Dr. Balser, you give me great confidence. I know you give our community great confidence, you and your other leaders at the medical center. And so I want to really thank you for sharing this information with our community. And I want to thank you for your continued partnership at this incredibly critical time. I can't imagine a better partner to have in navigating this really challenging pandemic. Thank you.
Oh, it's an honor and a pleasure. We're all in this together.